Rhodiola is a plant that grows in the cold, high-altitude regions of Europe and Asia, and it's the root that's traditionally used in herbal medicine. It's often called an adaptogen, a term used for substances that are supposed to help the body handle stress. You'll usually see it marketed as something that can reduce fatigue while boosting energy, stamina, strength, and mental performance. But how well does it actually work, and how does it compare to ashwagandha? Most of the attention around rhodiola is focused on stress. Some studies suggest that taking around 200 milligrams twice a day for a few weeks can improve how stressed people feel, along with their ability to function day to day. However, many of these studies don't include a proper control group, which makes it hard to know how much of the effect is actually from the supplement itself. In people dealing with burnout, similar doses over a longer period, like 12 weeks, seem to slightly reduce feelings of stress and fatigue. But again, the weakness of these studies limits how confident we can be in those results. Where rhodiola looks a little bit more promising is fatigue, especially mental fatigue. Small studies show that rhodiola can help students feel less mentally drained during exams, and shift workers report feeling less fatigued and performing better on mental tasks after taking it for a couple of weeks. There's even some evidence that higher doses of rhodiola can temporarily improve focus and memory after sleep deprivation. So overall, rhodiola might help people feel less exhausted and more mentally sharp, particularly under stress, but it seems to affect perception more than measurable physical stress markers like cortisol or blood pressure. Rhodiola is often compared to ashwagandha, another popular adaptogen, but they're not quite equal when it comes to evidence. There aren't any studies that compare the two, but ashwagandha has been studied much more extensively, especially for stress and anxiety. Multiple clinical trials show that taking between 300 and 600 milligrams can noticeably reduce stress and anxiety. In some cases, it even lowers cortisol, the body's main stress hormone, which is something rhodiola hasn't consistently been shown to do. Its effects can be stronger when combined with things like diet changes or relaxation techniques, and it may enhance the effects of standard medications like SSRIs when taken together. Furthermore, taking ashwagandha daily may help prevent stress-related weight gain when compared to a placebo. Some guidelines for treating anxiety disorders now include ashwagandha as a potential option, which says a lot about the level of evidence behind it. That said, the two herbs don't do exactly the same thing. Ashwagandha seems to have a clearer, stronger effect on stress and anxiety, while rhodiola leans more towards helping with fatigue, burnout, and mental performance. So if someone's stress mostly feels like exhaustion, rhodiola might still have a role, but the evidence is thinner and less consistent. When it comes to rhodiola for exercise, the results are mixed. Some studies suggest rhodiola can lower how hard exercise feels and slightly reduce heart rate during activity, but this doesn't seem to improve actual performance metrics like strength or power. In other words, it may help you feel less tired, but not necessarily make you stronger or faster. Rhodiola has also been looked at for mood-related conditions, but the research here is shaky. Many of the studies are small, and some aren't even placebo-controlled, which makes it hard to know how much of the benefit is real. In one study, people with mild to moderate depression who took 340 milligrams of a specific rhodiola extract saw an improvement in their symptoms after about 6 weeks compared to placebo. Another small study in people with major depressive disorder found that adding a higher dose, around 600 milligrams to their regular medication, led to further improvements. There's also some early research in college students suggesting rhodiola might slightly reduce feelings of anxiety and stress, and a small study in people with generalized anxiety disorder found decreases in both anxiety and depressive symptoms. So while these results are promising, they come with a big caveat: the overall quality of evidence is low. Overall, rhodiola is an interesting option, especially for stress and fatigue related to stress, but based on what we know so far, it probably isn't more effective than ashwagandha. Since the research on rhodiola is still pretty limited and not always reliable, I lean towards supplements like ashwagandha or L-theanine for managing stress and anxiety. Hi, I'm Dr. Brian Yeung. I'd love to hear your thoughts. Feel free to share them in the comments down below. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. And if you know someone who could benefit from this, please share it with them. Finally, if you enjoy what we do and want to learn more, consider supporting us on Ko-fi, and be sure to check out our other socials as well.